Hey, how's it going? Thanks for joining. Welcome to the live stream. I'm going to be on answering some questions, orthopedic, musculoskeletal, medical in general, and hopefully it provides some good information, get some of your guys' questions answered. Thanks for joining. Thanks for supporting the channel. Appreciate it. So for those of you who don't know me, I'm Dr. Matthew Harb. I'm an orthopedic surgeon. I do minimally invasive hip and knee replacements in Washington, D.C. and Maryland. I also take some orthopedic trauma call. I have a pretty busy practice here and not on call this weekend, but I do have a full clinic and full schedule next week. So thanks for joining. Hi, Belly. Hey, what's up? Thanks for joining. Appreciate y'all supporting the stream. Looks like we have the most, I think. Yeah, wow. So we got a lot of you in here. So any questions, drop them in the chat. I'll go ahead and answer them. And anything that's on your mind. I mainly focus on musculoskeletal disease, though. My mother at 75 can't have a can't have a knee replacement. What is the best to do now? You know, the question would be, why can't she have the knee replacement operation? That would be helpful information to know. You know, is there a risk factor that's maybe modifiable that you could change to make her a better candidate for surgery? If she can't do anything, then the best step next step would probably be to do what's called cortisone injections in the knee, or some type of gel injections. Yes, I am an orthopedic surgeon. She's too sick? Yeah, so probably cortisone injections in the knee are the best options if she's too sick. There's braces, there's ice therapy, there are gel injections, and then there's anti-inflammatory medications. What do you wish general practitioners know more about referring you patients? So if you're at end-stage arthritis, bone on bone, you know, it's a general practitioner could always initiate conservative therapy. And I think the biggest thing for general practitioners is knowing when something is indicated surgically. So when it's grade 3 or grade 4 arthritis, quality of life is disrupted. And when you get to that point, that's when it's a surgical indication. So knowing that would be very helpful. Hey, what's up, Boba? What helped you stay motivated when you were a student? You know, I really wanted to be an orthopedic surgeon. Orthopedic surgery is one of the most competitive specialties out of all of them, so that helped me stay motivated. What's faster to recover from, a hip replacement or a reverse shoulder? Definitely a hip replacement is quicker to recover from. I have lupus in my immune system and I need a knee replacement, have bone on bone. Do you think I should do it? Yes. So I operate on a lot of people with autoimmune diseases, with things like lupus, rheumatoid arthritis. Those are all risk factors for developing arthritis. Part of the reason is the medications and the treatments for those diseases actually can cause some arthritis, but also the autoimmune part of the disease can attack your joint, attack the linings of your joint, and cause early arthritis. So lupus, very common to have a early bone on bone. You know, if your quality of life's affected, if your x-rays are bad, if steroid injections in the knee aren't helping you, or medications aren't helping you, then yes, it's perfectly safe to have. What's your take? Hey, what's up? What's your take on regenerative treatments? There's not a lot of good regenerative treatments for cartilage. You know, some people may market that this injection or so-and-so regenerates the cartilage. That's really not true. There haven't been a lot of studies to prove that. So our regenerative medicine in the knee is actually very limited. There's not a lot of data on PRP or stem cells. If you have fluid in your knee, do you drain it or do a replacement? So usually if you have fluid in your knee, there's an underlying cause. And if the underlying cause is arthritis and that doesn't get better, then a replacement would be an option, but you would do conservative treatment first. Thanks for all the double taps. Thanks for the likes. I appreciate it. Going in for a MUA tomorrow after TKR, is it your fault? No, it's not your fault. Some people, anywhere from 1 to 5% of people can be prone to getting arthrofibrosis or stiffness after a knee replacement, so not uncommon. During my therapy after total knee replacement, I hurt the top of my calf muscle behind the knee. It hurt so much I could hardly walk. I sent a message to my surgeon. You could have a calf strain. You know, I would watch it. Sometimes those can take a couple months to get better. If I work out a lot, can I rebuild the cartilage in my knee or just the surrounding muscles. You can only rebuild the surrounding muscles. Unfortunately, the cartilage will not come back. Hey, what's up? Hey, doctor, my 66-year-old mother has JRA, which is juvenile rheumatoid arthritis, and had 8 hip replacements. That's a lot of hip replacements. My question would be, why so many? Was it an infection? Anytime you have autoimmune diseases, the risks of the procedure can be much greater. Yeah, if you guys have questions, just drop them in the chat. I'll go ahead and answer them the best that I can. What do you do if your SI joint shows mild deterioration? I would avoid doing an SI joint fusion. I would probably just focus on therapy, stretching, trying to do different exercises to open up the SI joint, and you can do anti-inflammatories as well. I'm a week and a half after total knee replacement, walking freely with no pain. You gave me the courage to do this. Thank you. I'm just here to help, make these processes as easy as possible. So, if I provided some relief for you in that, I really appreciate that comment. That means a lot to me. I had distal radius surgery in August of 2021. They're saying, remove the titanium plate, should I? If the plate is not hurting you or not causing any issues, I would keep the plate in place. I wouldn't take it out. There can be more complications with hardware removal. You may have to go in a cast after. And so that can be a bigger issue. The fall moved her artificial hip joint. How hard do you think recovery will be? If they have to take out the hip and socket or the ball and socket and completely redo it, that can be a really big recovery to do. Hey, what's up from Mexico? I really appreciate all the support for the channels. We've grown a lot in the last couple weeks. I have lupus. I've developed rheumatoid arthritis 10 years prior. I have scoliosis. Chiropractor hurts. Should I do back surgery? I would avoid back surgery if possible. If other joints like your hip are bothering you, then I would probably do that one. You have a lot going on. Those are a lot of bad conditions to have, but I would try and avoid back surgery at all costs. I don't think it doesn't always make you better. Even though you have bad issues, sometimes surgery can make you worse. Hip replacement's a lot easier to undergo than if you have hip issues. Hip replacement, I would say, out of a lot of the surgical procedures, is one of the more easier procedures to recover from, even though it is a big operation. I'm frozen. Let's see. Let me just make sure my internet connection is good. Okay. Both of my knees hurt where I tore my meniscus twice before. Should I get an MRI? If you have a meniscus tear, it can be helpful to get an MRI. We usually do physical therapy, ice, sometimes injections, anti-inflammatories, things like that. If it doesn't heal, we could go in there with a camera. My pleasure. I love getting on here answering questions. Is there a non-invasive treatment for bunions? If not, current surgical procedures are pretty fast for healing. So my partner does most of the foot and ankle surgeries for the practice. They do have minimally invasive bunion surgery. That is becoming a more and more common thing where it's done through like 3 or 4 small incisions. Yeah, I mean, if you have arthritis in the hip and it's painful and bothers you every day, then hip replacement would be indicated. Is knee tightness normal after 3 months after post-op from an ACL reconstruction? The answer to that question is yes. It can take even kind of 9 months to a year to recover from ACL. During my hip replacement surgery, the surgeon broke off a drill bit in my pelvis. What now? Just leave it. Probably more damage to go in there and take it out. Many people have metal in their body and it probably isn't causing you any issue. So I would leave the drill bit. It happens, but it usually doesn't cause any issues. I've actually never seen a broken drill bit that's actually caused an issue. My lower back isn't right. I can't turn from side to side and it's hard to walk. Lower back is one of the most common orthopedic complaints. And so physical therapy can be helpful, anti-inflammatories, those can all be helpful. Getting an x-ray if none of those are better, and then even an MRI to look at the lower back. But I would say that'd be down the line after you fail conservative treatment. 9 months after a total knee replacement, why does it grind? I did tear the quad a month after having it done. So if you had a quad tear after a total knee replacement, then it probably grinds because there's excess scar tissue buildup, and that's the most common reason. It also depends what implant was used, and certain implants are more prone to what we call crepitus or clunk, and so that could be an issue. As an orthopedic surgeon, what's the craziest surgery you've ever performed or seen? I've seen a lot of crazy surgeries. It would be really hard to pick just one. You know, you see over the years, you see a lot of crazy stuff. It'd probably be like some type of crazy tumor case, orthopedic tumor case. Bone on bone, let's see, bone on bone, both knees. Is a total replacement the only option? So for end stage arthritis, for bone on bone, really total knee replacement is the best option. You could try steroid injections, but eventually those would probably wear off. And if those wear off, then knee replacement is the final option. We always try conservative treatment before doing a surgical operation, but those are, you could try gel or cortisone injections. Hip replacement last year, so glad I did it. Zero pain now. That's great. Hip replacement can be can be a quality of life procedure. People have good outcomes, and most people are very satisfied after hip replacement. I do telemedicine visits, so if you need a second opinion, or I have patients travel for surgery as well. There's a link in my bio to get to my website. I also answer questions in my Discord channel. I'm starting a medical Discord chat as well. So if I'm not on live stream and you have questions, you can always drop them in there. Chronic regional pain syndrome after surgery, can the risk be high for it to travel to that area? Chronic regional pain syndrome is a difficult condition to deal with. You can see pain medicine. They'll sometimes do vitamins and things like that. Sometimes they have denervation procedures. Where am I located? I work in Washington, D.C. and Germantown, Maryland. In Washington, D.C., the hospital I operate at is Sibley Hospital. It's a Johns Hopkins hospital. Questions to ask when meeting my surgeon first time after fracturing my wrist. It depends on how bad the wrist fracture is. The question would be, do you need surgery or do you not? I've had hip pain and I've been told I'm end stage, but the pain is magically gone. How do I keep it gone? So arthritis goes like this. It goes up and down and up and down. And so if you develop arthritis, you can have a flare up. You can get an elevation from baseline. And the goal is to try and get back to baseline. But I would probably say if it is really bone on bone, then it will probably flare up in the future, and there's not a lot you can do about it. Stay healthy weight, avoid things like smoking, avoid drugs, try and control any secondary medical conditions, and all of that can be helpful, but it probably will flare back up. Do I utilize PAs? Yes, I do utilize PAs. I have a PA who operates with me on all my procedures. Had a total knee replacement in May. It still hurts. You're not that far out from the procedure. I would still work on therapy. People see improvements even 6 months to a year after the operation. Any trauma call? Yes, I do take some trauma call. About 14 years of schooling. Safe pain management for very bad knees. I usually do a NSAID like meloxicam. Meloxicam is a very good medication. I just got a kidney transplant last week. Congratulations. That's awesome. That's really cool. Protect it. Protect your kidney transplant at all costs. Had a total knee in December 2019. Is it normal to have pain and be able to barely walk and go up and down the stairs? I'd probably get a second opinion, rule out infection, rule out loosening for your knee replacement. Thoughts on gel injection? They can be helpful. It is maybe a little bit of a band-aid to buy some time before having a replacement. The gel injection is not going to have bring your cartilage back. UAB, the University of Alabama. If you have a cortisone shot, is it true you have to wait 6 months before total knee? No, I usually wait about 3 months before total knee. There's good literature to support that there's a very minimal infection risk if you wait 3 months after cortisone injection for getting a total knee. I have really good guides on my website. My website's through my link in my bio. There's other like orthopedic equipment and things like that. And well, oh, you're a surgeon at UAB. Awesome. Are you ortho? I grew up in Louisiana, so I wasn't too far from Alabama. I went to LSU, so I'm not a Nick Saban fan. Will numbness on one leg go away 3 months after an ACL reconstruction? It sounds like you had some nerve damage. Nerve damage can take a little while to recover. It can take, go Tigers. Yeah. It could take a while. I've seen nerves come back even 1.5 years after the operation. And so I've seen nerves even start to reinnervate 1 year, 1.5 years after the operation. There's no guarantees with nerves. Nerves can be finicky. They grow about 1 millimeter a day. So it's something to keep an eye out for. If you feel like tingling or little zingers, that's usually the nerve reinnervating. Bossier City, yeah. I was in Shreveport for a little while, then I was down in Baton Rouge, Louisiana. Oh gosh, now we're starting the college football rivalries in here. Yeah, I had a bunch of friends who went to Alabama. I've had golfer's elbow for years. You could do an injection. Steroid injection can be helpful for golfer's elbow. No, that's awesome, Jock Doc. Nice to meet you. Yeah, I'm orthopedics. I do mostly hip and knee replacements. I do a lot of same-day hip and knee replacement operations. I'm in Washington, D.C. and Maryland. Hey, how's it going? Good. How about yourself? Just getting ready for the week. A busy week ahead. What's the treatment for a soft tissue sarcoma in the limbs to remove it? Depending on how invasive it is. If it's a big soft tissue sarcoma, you may have to take off the whole limb. If it's small, there may be a reconstructive procedure. So it depends on the size. And also if it's any metastasis or anything like that. Complications of Liz Frank fracture surgery. You can have persistent stiffness or pain, especially when there's change in weather, when it's colder or it rains. Yeah, I do an anterior hip replacement. It's my primary hip replacement. I only do posterior for like revision surgeries or really super obese patients. 15-year-old stepdaughter wants to become an orthopedic surgeon. Work hard. It's one of the most competitive medical specialties to get into. What systems do I use? I use a lot of Donjoy. I use some Stryker as well. Hips, I use some DePuy. I've used all the systems before. Have you seen any research on apple cider vinegar and its effects on arthritis? There are no published studies on apple cider vinegar. There are a lot of people who claim that there are health benefits. If you have arthritis, there's also some newer studies that turmeric can help. So, if you take it and it helps you, great. So it's not something that's really going to harm you. So if you have arthritis, you can test it out. Test out some apple cider vinegar, test out some turmeric. Turmeric, there's studies to back up. Apple cider vinegar, not so much. Greetings from White Marsh, Maryland. Hey, what's up? How tall am I? I'm about 6'1". Do I work with CRNAs? Yes, I do work with CRNAs, especially at my surgery center. I got surgery in 3 days for my foot. I wish you a quick recovery. How can you tell if you need a hip replacement? So there's a couple different requirements for a hip replacement. The first thing is you have to have bone-on-bone arthritis on your x-rays. So we call that kind of grade 4 changes. And then the second requirement is that you have to have some, either one, failed conservative therapy, or two, you have a real difficulty with quality of life, meaning, activities of daily living, things like going upstairs, going for walks, walking on uneven ground, all those things you have difficulty with. And if you have issues with all those, then you're indicated for a total hip replacement operation. Partial knee replacement if I have a non-union on my plateau. If you have a non-union on your tibial plateau, it sounds like it was from a prior fracture. If it was from a prior fracture, then usually we're probably going to do a total knee replacement. It depends on a couple different things. It depends on age, your ACL status, your overall condition of your knee. But it may be a total over a partial knee replacement. The thing, you could be at risk for a fracture with a partial knee replacement. Thanks for all the double taps, likes. I really appreciate the support for the channel. You guys have been great. Suggestions for bone-on-bone in the L3, L4. Physical therapy, anti-inflammatories can be helpful. Stretching. I would try and avoid a fusion if you can. If I do robotics, what system? I've used GPS navigation. I'll use what's called Ortho Align. I've used Stryker Mako robot before, but I only use robotics or GPS in like very difficult cases. Hip scope, no, I refer to my sports medicine partner to do hip scopes, so I do all the replacements, he does all the hip scopes. I had bone-on-bone arthritis. It was so painful, 10 months post-op, still in some pain. Surgery can take a little while to recover from. Most people recover about 80-90% in 3 months, but you make improvements even a year after the operation. Is a hip debridement a precursor to hip replacement? Not always. Sometimes a hip debridement can actually push off a hip replacement. The whole goal behind a hip debridement is that you're getting rid of what's causing the impingement and the arthritic damage so that you can hopefully avoid a knee replacement. Who's best to see with a leg amputation that needs surgery again? I would say what's going on with the leg amputation. If you have distal flap breakdown, it may be helpful to see a plastic surgeon. The other people who specialize in amputations are vascular surgeons, general surgeons, and then I would say orthopedic surgeons aren't doing as many amputations. That doesn't mean that we don't do them, but I would probably go to a plastic surgeon. How long does a hip replacement last? About 60% of hip replacements are still intact at about 30 years. I had right hip surgery in January 21. It seems like my hip doesn't belong in my body. It may be helpful to get some updated x-rays, see what's going on, see if there's any issues. Most people, I would say, do not have that sensation. Hello, sir. I just had a total knee replacement. How can I get the swelling down faster? I usually recommend a ice machine if you're having a lot of swelling post-op. If you look in my bio, there's a link to my page, and on that page there's an Amazon link that will get you over to ice machine for the knee post-op. I give that to all my patients. So ice, elevation, using a compression stocking can be helpful, and using it 5 times a day, 20-30 minutes, 5 times a day, ice, elevation, putting your leg up on pillows above your heart, and compression stocking. Those are kind of the most helpful. And then after that, it's really just about time. So giving the swelling time to come down. Hey doc, do you like the Zimmer Persona system? I've used Zimmer Persona before. It's a good knee replacement. It's not my primary go-to knee replacement, but yeah, it's a good system. Swelling can be one of the hardest things to get down after a knee replacement operation. Everyone swells differently, and everyone's time to swelling coming down takes a little bit different. How do I know if I have a foot drop? So if you have a foot drop, you can't lift your foot up, meaning the opposite of pushing on the gas. And so that would be a foot drop. You would also have numbness probably over the top of your foot. Knee replacement is loose, has to be tightened. How do they do this? It depends what kind of loosening. If the whole implant's coming loose, they'll take out the whole knee and put in a new knee replacement. If it's just one piece, they may change out the plastic piece. Bursitis hip pain, you can do a cortisone injection for bursitis. It usually works pretty good. What is orthopedics? Orthopedics is the treatment of muscle, bone, tendon, joint conditions. My daughter's in the first year of college, wants to be an orthopedic surgeon. What advice? I would say try and get on as many research projects as you can. Reach out to the university. Try and get research. Try and find mentors in an orthopedic department. Try and get volunteer hours at the hospital. Shadow an orthopedic surgeon. Those are all things that she can do. And also good grades. Do all ortho surgeons have a specialty? Now, since orthopedics is so competitive, especially if you want to live in a kind of more urban setting or a densely populated area, then you really need a fellowship to get business. General orthopedics are more common in kind of rural areas, and it's becoming less of a thing. Usually, most everyone's going for a specialty. I'll be facing a knee replacement revision, but I have to have sounds like a lymphocyte test done due to metal sensitivity. Yeah. Sometimes we do that. There's a great website called orthoanalysis.com. If you're looking at metal sensitivities, you can actually go to their site. It may be cheaper to get it done there. Your insurance can actually cover it too. That's orthoanalysis.com to get metal testing. The most common metal allergy is to nickel. You order a blood test kit from them, they'll mail it to you, they'll draw your blood in the office, they'll send it back, and you submit that receipt to your insurance company. They usually cover it. You'll see if you're allergic to nickel, and then they can choose to put in a non-nickel implant. I'd like to send an x-ray of my 76-year-old mom. Ortho says surgery, but has an option for non-surgery with a 15% chance of non-union. Yeah, so I do telemedicine visits. If you look in my bio, there's a link. It's Matthew Harb MD/links. I do telemedicine visits as well, and so people definitely do that. Send me x-rays and we can talk about it and talk about risks. And then a lot of people do travel for surgery. Piriformis syndrome relief, stretching, some deep tissue massage, some anti-inflammatories, definitely get in for some physical therapy. I would say we're not usually having to operate for piriformis syndrome. Most of the time that will resolve on itself. I had a total knee in 2013 that's popping. I now have Addison's, don't know about healing. That can mess with your cortisones, your hormone levels, and so sometimes that can cause bigger scar tissue buildup in your knee. It's not uncommon that some people may have some clicking or some crunching depending on what implant they have. My shoulder pops out of place once or twice a month. What's the fix in the downtime? So you probably need a stability procedure on your shoulder. It's usually a big operation. It depends exactly what's going on in your MRI. It can be even 6 months to a year for recovery. I tore my glute minimus. Is it surgery the only choice? I would say most of the time we're not doing surgery for a glute minimus. If it's gone 6 to 9 months with no relief, then we may do an operation. But gluteal, like glute minimus or medius surgeries are not always the best. Does having a PAO complicate a THR in the future? So yes. Whenever you have a previous surgery on your hip, whenever you have another surgery, it's called a conversion surgery. Anytime we do conversion surgery, it's at a higher risk for complications. Can yoga help stenosis? Yes. There are some good studies. Tai Chi can also help stenosis. That's just strengthening all the muscles around the spine. It depends the level of stenosis. That can be measured on usually an MRI or CT scan for the lower back, but exercise can always be helpful. I learned more from you than watching the ortho docs I work for. That's great. I love it. Do I have experience with Osgood-Slaughters disease? Yes, I do. Osgood-Slaughters is usually more common in younger adolescents, usually before their growth plates have fused, so I would say under the age of 16 or 18. And most of the time, the treatment would be activity modification. Sometimes we'll do compression wraps, sometimes we'll do anti-inflammatory, some rest, getting it to heal. We're very rarely ever having to put someone in a cast for Osgood-Slaughters. It usually does burn out as you get older. Will you hold my hand when I have shoulder surgery on Tuesday? I would love to, but unfortunately, I'm probably not going to be wherever you are. Let's see. How do you make a virtual appointment? So if you go to my bio, there's a link in my bio. It's matthewharbmd.com/links. You can schedule an appointment. We can set up a telemedicine visit. What part of Maryland are you in? I want to come see you. So my main office is in Washington, D.C. I have an office in Germantown, Maryland as well. And I do telemedicine visits as well. The links are all in my bio, matthewharbmd.com/links, and you can find everything. Acetabular fixation experience. I've done acetabular fixation a good number of times. I usually, at this point, am doing referring that over to my trauma colleagues, but I do have experience with it. I fractured my humerus in April, still limited movement, it sounds like. It can take a while, especially if rotator cuff or muscles are torn around it. Finally got my surgery set up September 8th, super path. Great. It sounds like you probably picked an experienced surgeon. That's good. If you feel comfortable with your surgeon, there's really good guides and info on my website for hip replacement, so that can be helpful. How many call hours do I do? So my call right now is optional call. I was doing 3 weeks for every 6 months. This time I'm only doing 1 week of call over 6 months period, so not too much trauma call right now. I have a labrum tear. Can it heal on its own? Yes, it can. Would you get a PAO for a lateral center edge angle of 14? PAO is a difficult procedure. For me, if you're not having pain or a lot of dysfunction on a constant basis, I would probably try and avoid a PAO if possible. PAO is a really big operation. A lot can go wrong with it. It depends on your pain level. What else can be done for knee arthritis besides surgery? We can do things like ice, brace, anti-inflammatories, activity modification. We can do things like cortisone or gel injections. We can, going in there with a camera to clean it up usually doesn't work if it's very bad arthritis. And then the next step up would be a knee replacement operation. Is massage therapy effective for stenosis in the back? I will say I do have patients who go for massage in the lower back, and it does help massage and stretching. What is it that you leave in place on a knee replacement for stability? So the actual piece in the middle, let's see. Okay, give me a second. I got a knee replacement model right here so I can actually show you. Let's see. Okay. So we got a nice little knee replacement model right here. So this piece in the middle is called the polyethylene. The polyethylene is, you see how the design of the knee replacement is such that it has this concave area, and you see if you look at it from the side, it's lipped in the front. This is about a 9 millimeter buildup in the front, and there's a small millimeter buildup in the back. This one has a post for extra stability. This is called a post or posterior stabilized knee replacement. And then the other option we have is what's called a cruciate retaining knee replacement, where, let me see if I can pop out this polyethylene piece. So if you look at this one, this doesn't have a post, still the buildup, but all the conformity in the knee and stability of the knee replacement actually comes from this polyethylene or plastic piece in the middle. So you just pop that into place. Once that's in place, you put the knee back, and then you have a nice moving knee replacement. So that's what I usually use. I use what's called the cruciate retaining knee replacement. I don't usually use this, the PCL knee replacement. And so that can be helpful. And then keeping your ligaments, keeping your MCL and your LCL ligaments for stability. What is your perspective on stem cells, PRP, and prolotherapy? There's not a lot of great literature. They can be very expensive. I'm usually not recommending them for my patients. I have seen a lot of patients who have come to me for second or third opinions after they've gotten injections and they end up needing a knee replacement anyway. So I usually tend to avoid those unless you just have a lot of money to spend on something that probably isn't going to work that well for you. What company do I use? I use a lot of Donjoy, Stryker, DePuy. I've used all the companies. I've used some Smith & Nephew here and there. It depends on what the patient's bone quality is. A lot of patient factors go into implant decision, but I do have experience with all the systems. Appreciate all the double taps, follows, stream shares. It's all helpful for growing the channel and the live, and you guys have done great for that. So what's the recovery for a hip replacement? It takes about 6 to 8 weeks for a hip replacement recovery. I would say that's about for 80-90% of the recovery process. People do make improvements even 6 months to a year after the operation. Looks like someone just made an appointment online, so I appreciate that. You know, I do telehealth, as well as there's great guides and info if you're going for a knee replacement, hip replacement, or know someone. There's really good guides on my website. Do I operate on feet? I used to. If it's a traumatic injury, then I would do a foot surgery. You know, I know how to operate on feet, but I'm usually referring it to my foot and ankle partner. How many times are the MRI reads different than what you see in surgery? It depends what the read's for. You know, obviously, MRI is good. I would say MRI is probably about 98% accurate. The best accuracy is going in there and looking and seeing what's going on. Age limit for joint replacement? No age limit. I've done if someone fell and break their hip, I've done a 106-year-old for a replacement. But if, you know, for elective primary joints, I've even done people as old as like 86, 88. What happens when you no longer qualify for a knee replacement? Was told you only get 2. That's not true. At least in America, if you have insurance, you have bone on bone, you have quality of life issues, you qualify for a knee replacement. There's no longer qualifying. How many days would it take for a wrist fracture to heal? Usually about 8 to 12 weeks. My total knee replacement wasn't great after 14 months. Then I fractured the femoral head of the same leg, and now my knee is worse. I did 9 months PT, hydrotherapy, hypnotherapy, acupuncture, TENS, what now, 75 years old. If your hip is messed up, I would probably get a hip replacement if you have arthritis in your hip. And then if your knee still isn't good, I would rule out loosening or infection. And if that's all negative, you know, hip issues can cause, thanks for the telescope. Hip issues can also cause knee issues. So, you know, in the worst case, there's an indication for a knee revision, but it would be going through your films. What kind of doctor am I? I'm an orthopedic surgeon. I do a lot of specialize in hip and knee replacement. Should you have TKR at the same time, or how long between? I usually recommend that people space them out. There's a little bit lower risk of complications if you space them out. I will do them 4 to 6 weeks apart, but yeah, I usually recommend to space them out. Staggered operations is what we call that. Cost of a virtual appointment, so it's usually covered by insurance. What will happen is if you set up a virtual appointment, the staff will make sure everything's all set up for you and go through your insurance and things like that. Where am I located? Washington, D.C. and Maryland. Have you ever had a non-union complication? I think anyone who has ever done orthopedic surgery has experienced a non-union. And you know what I mean for that is, let's say, you know, here's an example. A 50-year-old's riding the motorcycle, gets hit by an 18-wheeler, gets what's called an open tibia fracture, meaning he goes off into the bushes and there's a bunch of dirt that goes in his fracture wound. And then you fix him, you clean it out, you put in a nail, and then he comes back and gets infected because it was all covered with bacteria and it was an open fracture. So that's a non-union, right? Doesn't heal, gets infected, and so if you don't want, every orthopedic surgeon has dealt with non-healing bones. Sometimes there's patient factors that you just can't control for. So non-unions don't happen in hip and knee replacement because you're not breaking a bone and requiring it to heal. You are putting in metal implants. So that's not a lot of something that you have to deal with as a hip and knee replacement surgeon. Dr. Harb, may you please use your spine model to show us what a herniated disc is in a treatment? Yeah, let me grab the spine model. I got a couple models up here. I got a hip replacement, a partial knee, and a knee replacement. So this is a spine model right here. And you can you see this little red thing in there? That's a herniated disc. So these are your lumbar spines. These are the vertebrae, and between each vertebra is a disc. When the disc herniates out, you get that little red area, and you see that little red area that pushes on the nerve. It can do one of two things. It can either push on the spinal cord, or it can push on the nerve. If it pushes on the nerve, then you get what's called a herniated disc. And if you get that herniated disc, then you get what's called radiculopathy, or radicular pain, and that's what a herniated disc is, and that's what it causes. So hopefully that's helpful. And it can herniate, and it can either push on the exiting nerve root, or it can cause stenosis and push on the spinal cord. Hey, what's up? How's it going? Thanks for joining. Appreciate you guys supporting the stream. Have you found hip arthroscopy with labrum allograft surgery to be beneficial for FAI with minimal hip arthritis and a labrum tear? It depends on a couple different things. It depends, I think that's a really good question. It depends on your age, it depends on your symptoms, it depends on your MRI or findings. I would say, there's two options here. You could undergo the lesser procedure, which is the allograft, undergo a really long recovery for that. And if you undergo a long recovery, then you may still end up needing a hip replacement operation even after that. So it depends if you're okay with trying one operation and it failing and seeing if you need the hip replacement, or if it's really bad and your quality of life is bad, and depending on your age, you could just go straight for the hip replacement operation, especially if there's minimal arthritis. I have people who play tennis, who play golf, who are very active with a hip replacement operation. And so that's a decision to talk to your surgeon about and think about, and maybe even get a second opinion for. Appreciate all the double taps, likes, follows. Thanks for supporting the channel. Probably get a couple more questions in here. Replacement revision, 3-month recovery. I would probably say most arthroplasty surgeries are about a 3 months recovery. My 76-year-old mom, obese. Do you recommend conservative therapy for a humeral shaft spinal or a humeral shaft spiral fracture? Sarmiento brace. Yeah, I would probably say most of these heal in a Sarmiento brace. It depends on level of displacement. If it's really far apart, you may need a surgery, but most of the humerus fractures usually heal in a Sarmiento brace. Thoughts on percutaneous surgeries? It depends what it's for. It can be helpful. What approach is best in a THR for hypermobile patient? I would probably go with an anterior approach. Do you accept VA insurance? I do have patients who come see me. They go through like a VA choice program, and then they come and see me. But yeah, I do virtual appointments, and I would just, if you schedule a virtual appointment or just call the number, if you go to Matthew Harb MD/links, you'll see all my links. You can schedule a telemedicine visit. Have I ever done percutaneous surgeries? Yes, I've done percutaneous surgeries. Done percutaneous surgeries for hip fractures, for femur fractures, for tibia fractures. For pelvis fractures. There's a lot of different percutaneous surgeries you can do. It just means making a small little hole. How fast would you do a surgery on Achilles? I would say Achilles surgery probably takes 45 minutes to an hour. I was home the same day after my total hip replacement. That's awesome. I do probably 70-80% of my hip replacements outpatient. So I do a lot of outpatient surgeries. My patients are up and walking immediately after and going home the same day. The best foot surgeon in town is Matt as well. Nice. I went into surgery at 7:30 in the morning. I was home by the afternoon. Yep. I would say so. I start at the surgery center. First surgery is usually 6:30. I would say that patient's usually home by like 11 or so. So it's usually like a 4 or 5 hour stay at the surgery center. Back to work after total knee tomorrow. 3 weeks. Nice. 0 to 132. You're crushing it. You are crushing it for 3 weeks. Good job. 16 weeks after a labrum repair for FAI. Tons of pain. In the front of the hip. Sorry to hear that. It sounds like you're recovering. Hopefully everything goes well and you don't need to go on to having a hip replacement. That's really the bailout for a hip that develops arthritis. Thoughts on chiropractors? Chiropractors can be helpful. Avoid neck manipulations. You don't want an early stroke. But I do have patients who go for chiropractic treatment and they get some relief. Thanks, I appreciate it. That's a very nice comment. How long do perfect circles take me? So I'm not doing a lot of perfect circles because I do a lot of hip and knee replacements. For a trauma case, it's like, it's like a bread and butter thing. It would take me like 3-4 minutes to put in a screw with a perfect circle. Like the biggest part of doing a perfect circle is just getting the x-ray to make the perfect circle. So any Smith & Nephew products you use? What are your thoughts on nickel allergy? Yeah, so if my patients have a nickel allergy, I will use oxinium from Smith & Nephew. That's what I'm doing for my nickel allergy patients. Am I a doctor? Yes, I'm an orthopedic surgeon. I do mostly a hip and knee replacement. Will any ortho docs do a full knee replacement over 50 BMI for extreme pain cases? I would probably say very rare. I did a BMI 45. 50 is really pushing it. I would say if you could get down to a BMI of like 43, 44, I would do your operation depending on your other medical conditions. But I did do a hip replacement on a BMI 46. He was 6'8" and 400 pounds. And that was tough, but the complication rate can be really high with BMIs that high. So do they do back surgery for arthritis and scoliosis? Yes. Scoliosis surgery is mostly done as a child. Arthritis or degenerative spine conditions and surgeries for that is done as you're older. A week earlier, I got my shoulder dislocated. How much time will it take for me to be back to normal chores? And what are the chances I have to undergo a surgery? If it's your first time dislocating a shoulder, I would say you'd probably be back at the 3-month mark, 2 to 3 month mark, doing more normal things. And most likely won't need a surgery unless you fractured everything. Broken hip versus broken pelvis, which is more severe? I would say there's a lot more broken pelvises that can heal without surgery than broken hips. A lot of the times, broken hips need surgery. Do you do a surgery for a plantar fibroma? It depends if it's causing you issues or not. If it's causing you pain. Hi, med grad from India. I have the option to go into orthopedics or general surgery. Would you say that dissection and diagnostic skills in ortho are comparable to other surgical fields? It's a lot different in the United States from other countries. Here, orthopedics is one of the most competitive specialties. There's a couple different reasons for that. You can have a good lifestyle. The pay is also pretty good. And, I love orthopedics. I didn't really like general surgery because I didn't like operating in the abdomen. I liked fixing bones. It was just more enjoyable to me. So that's why I chose orthopedics. I really enjoy doing hip and knee replacements and patients getting better, recovering. And so hopefully that answers a little bit of your question. But it's hard because there's so many differences between, medicine in different countries. Common sources of infection a year after total hip replacement. Common sources would be uncontrolled diabetes, would be dental infections, infections in other parts of your body, what we call poor protoplasm, meaning you have a bunch of other medical conditions, immunocompromised disease, autoimmune conditions, all those could be risks. Can you have a bad reaction towards K-wires? Usually not. K-wires are usually made out of stainless steel or titanium, mostly stainless steel, so usually not. Please tell me what type of doctor to see for my left hand dog bite in 2019. Lost the feeling in the hand. I would see a hand orthopedic surgeon, and I would probably ask the question if they specialize in nerve reconstruction. So certain hand surgeons will do more nerve grafting and nerve reconstruction, so that would be an option for you. Do I do surgery, knee surgery for arthritis? Yes, I do knee surgery for arthritis. I have a nice little hip replacement right here for arthritis. So, have you used cementless implants yet? Yes, I have. I probably use it about 15-20% of the time. It depends on the patient's bone quality and overall activity. Where did I train? I did my fellowship training at University of Virginia. I've had pain in my hip replacement for 2 weeks and numbness in my fingers. Sorry to hear that. I would probably see your surgeon. Antibiotics for how long? I usually give my patients antibiotics for 2 years after their hip or knee replacement. I have them take it an hour before, which is 2 grams of amoxicillin. And that's the not for routine cleanings, but for more invasive procedures. How common is hip dysplasia? It's actually very common. Severity can be different. Very severe hip dysplasia is much less common. But I really appreciate all the support once again. If you guys have any questions that I didn't answer, you can go to my medical Discord channel. The link is in the bio, MatthewHarbMD.com/links. You can drop some questions in there. I'll be in the Discord channel at answering some questions as well if you put them in. Am I in Virginia? I'm in Washington, D.C. and Germantown, Maryland. I have really good guides. All that's in my links. Check it out. But I appreciate you guys following for the stream, and I'm going to do more of these lives. Hope everyone has a great week, and good night.